Hi, my name is Kevin Moss. I'm a senior editor with Consumers Checkbook. We publish Checkbook's Guide to Health Plans for federal employees. Today we're going to talk about Medicare Part D, specifically Medicare Part D prescription drug plans. These are supplemental Part D plans. They're sometimes referred to as EGWP plans, and that stands for Employee Group Waiver Plans. Now, this is a new plan type. It's never been available before. So this is the first year that you're going to see these plans. This impacts many federal annuitants because there are 17 plans where this is now how you'll receive prescription drug coverage if you're an annuitant and you have both parts of Medicare. Many of you will be auto-enrolled with this coverage unless you contact your plan and say that you don't want it. But today, let's talk about how this has come to pass, what these new plans are, how they may benefit you, and go through the process of deciding whether this new coverage is going to work for you or whether or not you should contact your FEHB plan and disenroll from this coverage. So in 2022, the Inflation Reduction Act passed, and in that legislation was important reforms in how Medicare Part D operates. Some of those changes are now taking effect. So this year, you may have heard that insulin is capped at no more than $35 a month. Next year, there's no more catastrophic coverage in terms of having enrollees pay for something once you meet the catastrophic max, which is $8,000 next year a person. Next year also, Part D premiums can't increase more than 6%. That protection lasts until 2033. And then in 2025, and this is the big one, there's going to be a new catastrophic out-of-pocket max of no more than $2,000 a year for out-of-pocket prescription drug coverage. Now, historically, federal employees haven't had to really worry about Medicare Part D. And that's because your existing FEHB plan had as good or better prescription drug coverage than what you could find from a Medicare Part D plan. And oftentimes, even if you wanted a Medicare Part D plan, you'd have to pay an extra premium. So why would you want to pay an extra premium for something that your existing FEHB plan is doing an as good or better job? But that's no longer the case. With these new reforms, OPM opened the door earlier this year for FEHB plans to offer these new PDP plans or EGWP plans. Now, for 2024, 17 FEHB plans will offer this new coverage. Let's talk about what those plans are. So if you're enrolled in a Blue Cross plan, this is either standard, basic, FEP Blue Focus, NALC High, MHBP, either standard value or consumer option, APWU High, Rural Carrier, Foreign Service, Samba, High or Standard, Aetna Direct Consumer Option, and Aetna Open Access, High and Basic in the Mid-Atlantic area. If you're in one of those 17 plans, you will be auto-enrolled into this PDP plan if you have both parts of Medicare, Medicare Parts A and B, or if you have just Medicare Part A. Now that's true of all the plans except for Blue Cross plans. So if you're in standard, basic, FEP Blue Focus, you have to have just Medicare Parts A and B. If you have Medicare Part A only, you will not be auto-enrolled. Now, if you've been auto-enrolled, you will receive a letter from your insurance plan. By the time you're watching this video, you should have already received this letter alerting you that you will be auto-enrolled in this coverage. And if it's something that you don't want, you can contact the plan. They typically have a phone number for you to call where you can tell them that, no, I don't want the prescription drug coverage from the Medicare Part D plan. I want to stick with FEHB coverage. Now, in order for these Part D plans to be approved by OPM, the benefits had to be as good or better than what was offered from the FEHB plan. And that's true most of the time, but it's not true all of the time. So keep that in mind, and we'll talk a little bit about how that's not true in a little bit. So all Part D plans in plan year 2025 have to have that $2,000 a year catastrophic out-of-pocket prescription drug protection. But next year, there are some of these FEHB plans with the PDP that are offering it a year early. So Blue Cross Standard All MHBP plans, rural carrier, foreign service, Aetna Direct Consumer Option, and Aetna Open Access High and Basic in Mid-Atlantic. They're all bringing you that $2,000 catastrophic out-of-pocket max protection for plan year 2024. So if you have moderate to high prescription drug costs, these plans will perhaps save you quite a bit of money than what you're paying out of pocket right now with your FEHB coverage. Now, there's some reasons why you may not want this Part D coverage. Most of the time, the coverage is as good or better, meaning that the copay in your FEHB plan and the copay in the Part D plan is either going to be the same. In some cases, it may even be a little lower. But there is a possibility for that copay to actually be higher. And why is that? It's because of how the drug is classified by the plan. The drug formulary for the FEHB plan is managed by OPM. The drug formulary for the Part D plan is managed by CMS. And there can be changes in terms of how the drugs are classified. If the drug receives a different classification, then that may mean actual higher costs of your prescription drug in the Part D plan. So I highly recommend that any current medications that you take, that you go to the plan website. Many of them have pricing tools or a drug formulary where you'll be able to find out what tier your drug is going to be in and how much it will cost you. Make sure you double check that your prices are going to be no worse than what you're paying now, in some cases better. Another thing to consider is IRMA, which is income related monthly adjustment amounts. This is if you have income above certain thresholds specified by the Social Security Administration, you will have to pay a Part D IRMA payment. These Part D plans are no extra premium for you when you're auto-enrolled if your income is below the IRMA threshold. But if your income is above, and let's talk about what those thresholds are. If you're an individual filer, these have increased from 2023 to 2024. The new income threshold for IRMA is $103,000 a year. Now, this is adjusted gross income. If you're a joint filer, it's $206,000 a year. So if you are above those levels, you will have to pay a Part D IRMA, but the Part D IRMA is far less than Part B IRMA. So in the first tier of IRMA, Part D is around $13, but for Part B, it's closer to $70. It's around $67 or $68. So the IRMA impact is far less on Part D, and it's possible that the benefit of having the Part D plan, if you're just in the first tier, may outweigh that Part D IRMA, but you'll have to do that comparison to see if you're better off. Two other reasons where you may want to not consider the Part D plan. If you spend a considerable amount of time overseas, or even if you're traveling internationally, Part D plans by law from CMS do not provide overseas or international prescription drug coverage. If you had a month's trip somewhere internationally and you broke your leg and you needed some type of painkillers, those would not be covered from your Part D plan. That type of expense would typically be covered from your FEHB plan because every FEHB plan has emergency overseas care. But with Part D, you won't get any overseas prescription drug coverage. However, most travel insurance policies will cover any healthcare expenses not picked up by your health plan. So that's a way to sort of mitigate that risk, is having some travel insurance when you do travel overseas, which can help with that lack of prescription drug coverage internationally from Part D plans. And then the final reason to perhaps not consider the Part D plan is whether you receive any pharmaceutical discount programs. So these are discount coupons that pharmaceutical companies offer for a discount on purchasing a particular prescription drug. If you're receiving that type of support, you will lose that support. So enrolling in Part D disqualifies you from those assistance programs. So you'll want to carefully consider the value of that benefit to you, and also consider how that drug that you're getting assistance on will be covered by the Part D plan. Make sure you're checking that first to see, is that pharmaceutical assistance better than what I would get from the Part D plan? If it's not, and that matters to you, then perhaps disenrolling from Part D will be the right choice for you. So this is a really important subject. Unfortunately, the choices only get more complex for annuitants, and there's a new choice this year that's available that hasn't been available before. So make sure you're carefully considering Part D coverage this year. Many federal annuitants will be impacted by this because many federal annuitants will have Aetna Direct, CDHP, or one of the Blue Cross plans. So this is going to impact a lot of folks. But if you're in an FEHB plan that doesn't have this Part D coverage, and you do have moderate to high prescription drug costs, perhaps you want to consider one of these plans. If you do, make sure you're checking your prescription drugs to see how much they'll cost in these plans. Thank you for watching today's video. We'll also have a link in the description below where we talk about another way to receive Part D prescription drug coverage, and that is through FEHB Medicare Advantage plans. So that's another vehicle for you to receive Part D coverage. Any questions, any comments that you have, please put them in the comments. Thanks for your attention today.